Hello, hello, hello. Hello, Black Psychiatry. We are back. I know it's been a long time. I shouldn't have left you, but I'm back here. It's me, a doc named Danny, here with my wonderful panel. I know that they're all women, but everyone is welcome to join. We are going to get into all types of questions for the Black community. We are definitely here to wind down and to celebrate Bebe Moore Campbell's National Minority Mental Health Awareness Month for July of 2021. So thank you to all of my panelists for being here. Thank you to everyone who's watching now live and will watch later. So I am a doc named Danny. I am the creator of Black Psychiatry, or at Black Psychiatry here, bringing you another panel. I have to definitely shout out and mention that I now have a sponsor in the Department of Behavioral Health in DC, and also at Howard University institution that pays me, the Howard University R&R project with Dr. Hall Brown. So I'm going to just make sure that I put here a form for you. If you are in DC, if you are a healthcare worker, we are providing free. Yes, free. I know that it's not something that happens because mental health care and healthcare is a privilege, but we are providing free mental health resources and sessions for you. So if you are in DC, or if you are a healthcare worker, no matter where you are in this country, and we can do it remotely, just fill out this survey for us and we will get back to you that I just put there. We'll drop it subsequently later throughout the session. But let's get started, because as you can see, we have some wonderful panelists. I'm going to introduce them really quickly. However, you'll get to know them. They'll tell you more about them, what they do, and everything else. So first, in no particular order, just the order on my screen, we have Dr. Topaz Sampson, who is just a lovely forensic and community psychiatrist. I have been calling her my mini-me for several years, so I am super proud of her and thankful that she is here with us today. Hello, Topaz. And then we also have Dr. Nicole, who is here early for her Oklahoma time, all the way from a different time zone. And she's a psychiatrist, but she is an educator. She is a locums master. She is the psychiatrist to your psychiatrist and physician. So thank you, Dr. Nicole, for being here. We also have Dr. Sharifa, who is with me at Howard University. She is your neighborhood psychologist on Instagram, and you need to really check out some of the work that she's doing. And she's also director of the program there at Howard for psychology and counseling, like me at Howard. So welcome, Dr. Sharifa. We also have Amber Thornton, who's a mental health advocate and analyst. So she's going to have to tell us what a mental health analyst does and all of those things. She also has her own company about how you manage social media, mental health, when you need to take a break, how you get it all together. So she's going to tell us about that too. And then also another Howard alum and really part of the HU family royalty, if you don't know about The Simpsons. Dr. Sherry Simpson is also here. She is coming to us live from Atlanta. So, ladies, welcome. We have a lot to talk about. A lot has happened in the last 2 days with mental health, Black women, glamorizing overworking. We got to talk about Bebe Moore Campbell, how they want to take her name off of the month and change it. We got to get into it. There's a lot to do, so we are ready. Audience, of course, you can ask your questions. We have some questions. Well, you know, I always come with the questions, so I do have some questions for them. We are talking about anxiety, stress in the Black community. Someone asked me, actually, earlier this week, ladies, so I'm going to ask you this. You weren't even ready for this question, but someone asked me, does stress and burnout look different for Black people versus white people? Like, does it manifest in a different way? So I was like, I'm not gonna tell you my answer. I'm gonna let you all answer, whoever feels like you have an answer for that question. But really my question is, what are the biggest stressors and sources of anxiety for members of Black communities? Or are we're just here doing great, no problems? What do you say, ladies? Anyone can jump in.
Okay, well, I'll jump in. Don't y'all all jump in at one time? Yeah, we're tired. That's about all. We are exhausted. And I do think it comes out differently for us. It feels like, one, we're either very, very irritable, right? So we are irritable. Our fuse is short. So it does not take much for you to get all we got to give. You're going, as they say, you're going to catch all the smoke because we are tired. And sometimes that fuse is short and you just are going to get a lot of irritability and edginess. And sometimes when people are burnt out, they don't necessarily project that, but I feel like that's something that we will project. I have always said, whenever I see somebody angry, I'm always just trying to dig to figure out, but what's going on? Like, what's going on underneath there? Because when you get tired, you get really, really edgy. And I do also think sometimes that we don't always, like, for some people might not realize that we are burnout or tired or exhausted or just mentally drained, because we are just used to just pushing. And people just think, oh, well, that's just how they are all the time. And so I think sometimes our burnout and stress just gets overlooked as, well, that's just how she is. And I think that's pretty common.
Definitely, I agree.
Dr. I would add that in addition to heightened irritability, we may also present with a lot of chronic physical pain. So a person may say, I don't know what's going on. My back hurts, my head aches. There may be a lot of somatic complaints that suggest that we are burnt out. And that will also include fatigue, which very frequently isn't reported or seen in terms of stress and worry. People might think that they're just supposed to experience sadness or they're just supposed to isolate themselves, but you will see a lot of irritability as well as fatigue and chronic body pain within our population.
Yes, definitely, Dr. Sharifa. I can agree that a lot of times we don't hear like I'm depressed or I'm down, but you hear more of the physical complaints, more of the I'm not feeling like myself, more complaints about pain or headaches or different somatic or body complaints in our communities and with our stress levels. So definitely I agree. Anyone else?
Yes, I wanted to say that in my high functioning Black women, which most of us are seeing, it's this dissatisfaction with the level of execution, follow through, ability to accomplish tasks. Because I've had so many women, and my practice is in Atlanta, and it's primarily African American women. I accept everyone, but I tend to have more. I have mostly African American women, and about 40% LGBTQ plus. And it's a constant theme that my productivity used to be this. I'm not able to accomplish this. I'm not able to do what I usually need to do, usually can do. And with many Black women, it's a surprise that even during the pandemic, that they're still not able to do all the things that we're accustomed to doing. So that's a part of that strong Black woman paradigm, sort of eco model, that lack of insight of I too am affected, and this is how it will manifest. So I just want to make sure I said that.
Yes, thank you. Thank you, Dr. Sherry. I think that I'm going to make sure that Dr. Topaz Sampson is here. Okay, Topaz, you're ready to go.
Thank you, Danielle. I just wanted to really add on what you mentioned, Dr. Sherry, about this trope of the strong Black woman or the strong Black person, where it's presenting in a way where we're wearing like a mask, during our work day, during the daytime when we're interacting with other people, a mask where we're smiling, jovial, easy to accept and for others to kind of tolerate and be around. And then when we go home or in our safe spaces, we kind of take off this mask. And that's when, the anxiety, the stress, the depression is manifesting with people staying in their bed all day, turning off their phone, don't want to interact with anyone, don't want to really interact with their family, just kind of going through the motions. And I think this mask wearing or just really downplaying what's really going on with us to try to make everyone else feel, okay with our being is part of what the issue is, and we just need to stop it and call it out.
Calling it out. Yes, we don't always call people out here, but we at least call them in. We need to stop it, and we need to stop wearing this mask, because eventually you can't keep the mask on all the time, right? As you said, and sometimes that leads to all types of detrimental effects. Amber, you got anything for us?
Yeah, I just kind of wanted to comment on Dr. Topaz's comment. I think that we have a difficult time being vulnerable. In the Black community, it is very tough and it's super challenging to feel comfortable expressing these types of anxieties and stressors. Not all the time do you feel like you have that safe place and that outlet to discuss those types of things due to judgment or just through the lack of knowledge of that emotional part of it. So I think that that's very important to hone in on as well. We have to remember that, creating spaces like Black psychiatry and creating spaces that we all, all of the career fields we work in, I think it's important for us to allow each other to have that space so that we're not constantly wearing those masks and we don't constantly feel like we have to hide the anxiety and the stress. Because the truth of the matter is, with everything going on right now, it's inevitable that, we're highly stressed, anxious, experiencing depression. So I'm definitely an advocate for making sure that, people feel comfortable talking about that.
Yes, thank you. Thank you, Amber. Like, that hits on a big point that I hope we're going to get into tonight, ladies, about the lack of vulnerability and the inability to express your feelings. And if we haven't seen a good example of that anywhere else, we have seen it this week and a few weeks ago in a huge arena with Naomi Osaka, and then of course with Simone Biles, which you remember in 2020 in the pandemic when they were saying, "Oh, protect your mental health," and they were saying that they support you, self-care, and then as soon as you say, "I need a break, I need to step back," no one can understand that, and and people are questioning, well, why are you doing this? Do you even deserve to have this space? So why are we hearing so much criticism and pushback about Black women protecting their mental health and minimizing stress? Do you think that our society glamorizes overworking and being a strong Black woman? I know Dr. Sherry probably wants to jump in on that, but what's all the pushback? Well, remember 2020, the pandemic, protect yourself. Remember that businesses and corporations and companies wanted you to have all the self-care time you needed. Dr. Nicole, I can see you have something to say. Dr. Sherry.
Yeah, I did, yeah. So let me just say, I don't necessarily think, when you said no one, we got to be really clear who are the ones doing the pushing back. And what I've been saying all week to patients, Black women, what is the Olympics in your own life? And many of us show up on jobs and cannot take a break, cannot request time off, don't feel like we can say no. So I've seen a lot of support of Naomi Osaka and Simone Biles from Black women and Black people. I've not seen the same level of support from other people, but that's not a surprise. When I was actually thinking about this earlier, and I was just thinking about 12 Years a Slave when and I don't remember her name, but it was Lapita, and she had just been raped by Massa, right? And then she had to get up the next day and she had to shuck that corn and pick that cotton. It's the same when we're going through this every day, all day. And I was just so excited. I know everyone on this panel was so excited about them saying no, but then also for us, how do we manifest the no? Because the no is an indication, and it's really got to be a communication of resistance, that healing no. That you've got to, and I've been saying, stand down in 2021, don't add anything else to your plate, take things off your plate, be able to use your voice no. If you don't know how to say no, then that's when you need to get some help to learn how to say no. And back to Amber's point, I was going to say just really quickly, that many of us have not learned how to foster those relationships. So that pre-COVID, it was the facade of the interconnectedness. And then COVID came and people just weren't able to connect because those true bonds were not there. And so I think that was a part of the sort of that collective mass that meant that they came off for many Black women.
I love that, like, they're young and they are saying, like, hey, we're not doing this anymore. Like, you know, I'm no longer setting myself on fire to keep all the rest of y'all warm. It's a wrap. We're done. And I love that them on such a large stage are able to do it. And so then I'm seeing my patients, my Black women are saying, man, if they're Olympians and they can say, nah, I'm taking a break, I surely can take a half day to go to my doctor to get my health taken care of, or I surely can go take care of my business. And they are encouraging women who are decades older, who are in industries that we just have been beat down forever. I mean, we're all doctors. We've all heard the stories of the doctor who, you know, went to morning report with the IV pole because they were admitted on a hospital 2 floors up, but they had to go to report, right? I mean, I was a pregnant resident. I took call every other day for the first 13 days of the month, first 11 days of the month, so I wouldn't inconvenience my peers because, you know, I didn't want to have to deal with the side eyes and you know, oh, she didn't take all her call for the month. I mean, these young ladies are like, nope, this is what we're gonna do. And so I think they're encouraging people. They have no idea, and I think we're all gonna see a shift.
And I'm excited for it. Really, I'm loving what's happening. You know, it's unfortunate that it has to be this way, but what we're seeing is a full display of the experiences of many of us, like the normal Black people, not the Olympians. When we speak up and try to prioritize our mental health, what sometimes happens is what we're seeing, the gaslighting, saying that you're overreacting, shaming you, telling you that you're weak. Seriously, it's just an invalidation of your humanity and not giving the respect that all humans deserve to prioritize their mental health. And so I'm just really happy that we don't have to kind of talk about this just in circles by ourselves, but the full community of the world is seeing some of the difficulties we have in trying to advocate for ourselves and our mental health, the pushback that we receive. This happens daily. It's not just them that it's happening to. I can think of colleagues, friends, my own personal experiences where it's just like, hey, self-care is great for everyone, but for you, not really. You know, it's like, what's going on with that?
I was literally going to say that exact thing. It's like, yeah, you can take care of yourself, but not at the expense of my business or what I have going on. Like, I don't want you to mess up what I've created. I also think that it initiates the sense of fear. Like, we're afraid of losing jobs and taking that time because we don't want to then be without funds, because now we're really speaking to anxiety and stress to provide for our families, to you know, just the basic things that we need to take care of. So I feel like that fear is it's like an impending doom. It overwhelms you to the point where you don't, it's not that you don't want to ask for the time off, but you don't even feel like you have that option to take care of your mental health or to do what you have to do to make sure that you're mentally stable. And so that's just a whole nother realm of things, overcoming that fear.
I want to add this piece of understanding that they're not going to give it to us, right? Like, we have to say no. They are building systems that are still built on our labor, on our sacrifice. And we have to decide that we are free enough, whether we feel like we have the funds or not, right? Because that goes back to that piece around what are some of our unique stress and anxiety, right? Like, we definitely are coming into therapy around financial concerns, around stress regarding holding up families and being breadwinners in families and having children and things related to that. But we have to be able to say that I need me and this family needs me to be healthy, to be whole, to be happy. And so I can't be enslaved at this job. I'm free. And so I now stand in a river of abundance, right? Like I am no longer in this river of poverty. I'm in the river of abundance. And so opportunity is going to flow to me, flow for me, and flow through me, right? Like even if I miss this job, even with Shakari, like if I miss this opportunity, I stand in the river of abundance. So another opportunity is going to present itself. Another time for me to shine in a different platform, in a different stage is going to present itself. And that's exactly what happened with Naomi and Simone. They stepped down from this stage to step onto a greater stage to speak to Black women about self-care and self-wellness and how to balance all of that. And so I really think that we do all have to take note of how this looks in our lives, right? Like, I love that. What is the Olympics in our life? And how we can transition from this one stage to a different stage. And that is probably going to be even greater and much more light and freedom and footloose and fancy free. So I'm ecstatic. I'm ecstatic because I said, listen, I might not be going there.
Dr. Sharifa, I wish you were, I should have just walked over to your office last week at work. So I could have been feeling free at Howard University, the institution that pays us. But let me just say, y'all are bringing it. And we've only been doing this for like 13 minutes. Good. This is wonderful. So we have all types of quotes. Like, how does your no manifest? What is the Olympics in your life? And I definitely have to agree that even more than just who they have been as athletes, they've now shown us that anyone, this is something I just had to say in my own house yesterday, anyone can have a mental health issue. Anyone can need a break. Anyone can need the relief of this burden. So yes, thank you. Everyone is saying over here, preach Dr. Sharifa over here in the comments. So we're talking a lot about issues of stress for Black women, because we are, but we also know that Black men go through stress as well. Yes, Dr. Sharifa's River of Abundance. I needed her to tell me that last week. I needed a break. But let me ask Dr. Topaz, what role do you think that race plays in the effect and expression of mental health in Black communities? Do you think it's different for Black men versus white men? Do you think it's different for our Black children versus white children? We definitely know that it's different for Black women. We've said that. We also know that when Michael Phelps had a mental health issue, he got an app and some commercials and all types of advertisement. But Topaz, do you think that there is a difference in the way that mental health issues are expressed in our communities?
So, I really love this platform because we can just really address the elephant in the room and talk about race and racism and how that impacts our mental health. We can talk about racism as far as how it impacts healthcare when we look at the Black women's maternal mortality rate and, Black women be feeling anxious and stressed about having a successful pregnancy. We can talk about how racism affects housing and secure housing with gentrification and displacement of people and not knowing where you will be. We can talk about law enforcement.
Did Topaz freeze or was it me? Oh, it was Topaz. Okay. We'll come back to her, but I think that she was telling us that yes, there's definitely an effect of racism on, I said race, but yes, race and racism on the way stress and anxiety and other mental health issues are expressed and impact all of us. We will get Topaz back to finish her thoughts, but let me ask the rest of our crew here. Historically, the unique experiences of Black people have not been included in the typical scales, the assessments that we use to assess stress and anxiety. They don't ask these somatic questions. They don't ask the chronic pain question, chronic condition questions that Dr. Sharifa brought up earlier. Have you witnessed the implications of this in your experience or in your practices? And how can we manage these things? Like, have you seen misdiagnosis or underdiagnosis or just completely incorrect diagnoses because of these scales that people are using in psychiatry, psychology, counseling, and mental health advocacy?
I'm back.
You're back.
I'm back.
You're back.
I got cut off there, but I'm just going to start from the top because I don't know what you last heard.
Oh, go ahead. Go ahead. Yes. All
right. So we're addressing the elephant in the room when it comes to racism and how it affects Black mental health. You know, we can talk about racism when it comes to healthcare and how it impacts.
Oh no, we lost the
talk about housing.
Oh man. Okay, so that's log
and
out.
Not worry about gentrification and being relocated. Man, it is not working out for me right now.
I think because we're having storms over here in this area, in the DMV area. I think Topaz is in the V. Okay, Topaz, I want you to log out for us and then log back in. And in the meantime,
right,
I'm going
to have. Right
okay. In the meantime, I'm going to have the ladies answer for me. What do you think about these scales? What we look for in diagnostic criteria, if that leads to us missing important things pertaining to anxiety, pertaining to stress in our communities.
I can speak real quick. My dissertation looked at community violence among parents in Washington, D.C. and their experience of depression and PTSD. And so I gave the mothers a PTSD scale as well as a depression scale. And my depression scale was non-significant. Now, the mothers, I had multiple moms writing notes on the survey because this was, we were still doing paper surveys back then. And we're saying my nephew just was murdered. I'm so sad. This is like all of these things, but yet the depression scale was non-significant. It didn't reach a significant implication for mental health and mental wellness in this sample. And I was like, well, what? And I realized it was asking questions regarding not engaging with peers, having bouts of sadness and teary. And these were items that are infrequent, are not as frequent as we might think of in terms of assessing depression among African-American women. And so that was like the first time that I really was like, some of these standardized methodologies or assessments might not capture the true essence of what is our clients are experiencing. And so I think it is very important for clinicians of all trainings to really understand that one of our best tools is always going to be the clinical interview and how to ask questions that are very much culturally relevant to the population that we're working with.
Definitely. I see a lot of nods here. Anyone, Dr. Sharifa, got that, or anyone else have anything else to add?
Well, I was going to just add on to Dr. Sharifa. I mean, just personally, I've had to do a lot of sort of reassessments of my own diagnosing of patients. So when if I have 95% of Black women, okay, so what is the typical percentage of major depression? And then do I have a representative sample of bipolar? Am I diagnosing that based on the standard? Am I diagnosing panic disorder based on, again, the standard numbers? And so I've even had to, even ADHD. So if I say that we know that African-American women are disproportionately affected by trauma, which increases the level of neurodevelopmental behavioral issues, which include ADHD, even, and that includes Black women too. So if I know that, am I assessing for ADHD as well? And for a while, it was sort of across, sort of away from my radar. And so I think regardless of race and ethnicity, I think that we all have to make sure that we're addressing our own biases to diagnose them.
And I still see people diagnosed with bipolar disorder who, once you really start talking to them and you figure out that's a trauma response, like that's PTSD. That's not necessarily mania and depression. Like, that is somebody who's having a trauma response. And so I do end up seeing quite a few, Black women diagnosed with bipolar disorder. But once you start talking to them, I realized that this isn't adding up. Like, this doesn't make sense. It's not adding up. And of course, then they're not seeing benefit from treatment because we're not treating them appropriately. Borderline personality disorder. A lot of Black women are being overlooked, for having borderline personality disorder, and you keep throwing meds at them and nothing's getting better. And it won't until we get to the root of what is going on and we get them into a DBT program, which don't even get me started, right? Because they don't really address what we need them to address for us anyway. And so it's just tough trying to get people the right diagnosis. It's frustrating.
So I will say that we are talking a lot about what other people do, how other people assess us. But we do have some things that go on in our own communities, in our own homes, in our own families. And I really would like to hear, Amber, your thoughts on how we approach mental health issues, how we approach stress and anxiety in our homes, in our families, in our communities, and so that's part. And then what can we do to dispel really the stigma that prevents some of us within our own communities? And if you know anything about anything that I write and teach about, that the root for this stigma that we carry around with us started with enslavement and how you had to be able to survive chattel slavery, how you had to be able to survive and keep your positions, survive the civil rights movement, even surviving now by just keeping things to yourself. But how do we move on from this? How do we dispel this stigma? How do we really affect change in our communities, especially when we're talking about stress and anxiety, even talking about substance use and alcohol use?
Yeah, absolutely. Thank you. To answer the first question, how do we address it in our homes? To be quite honest with you, I don't think we do. I think that we refrain from having the discussion. I do think that it's in a transitional period right now where things are different and we are more comfortable with having the dialogue. Just again, for platforms like this, we're able to speak to it a little bit easier. But I think in the Black household, in the Black community, again, like we said before, you're labeled as weak, or, ain't nothing wrong with you, girl, or you depressed, you stressed for what? You know what I'm saying? So it's like this very derogatory way of labeling this stress and this anxiety. I think the way to try and push forward from that is to, again, be vulnerable, be okay with talking about it and saying, you know what, like we've been saying this entire discussion, saying no, saying I'm not okay, saying, this is stressful, owning that and really standing in your truth. And if something doesn't feel right, being okay with saying this isn't right. You know what I mean? And I think that for me, I've struggled tremendously with depression and anxiety because they typically go hand in hand. And I've worked in the field for, I don't know, maybe about 7+ years. And even with my own experience in managing all these caseloads, I've noticed that the more comfortable people feel with you, the easier it is for them to have that discussion. So I think that creating that safe zone, allowing people to be vulnerable and have that conversation, and then continuing to have platforms and discussions about it will in turn allow us to grow from it.
Yes, thank you for that, Amber. Yes, I hope we are all listening. Someone in the comments said that we have engaged in escape and avoidance behaviors in the Black community as well, but sometimes that's what you've had to use to survive, literally to survive here. So I have a question for Dr. Nicole.
I wanted to add on just a little bit too. Yeah. I think we have a little tolerance of conversation, right? Like I always go back to that scene in Harlem Nights where Richard Pryor is telling Eddie Murphy to go apologize to Della Reese. And he like, what? She all right. Like she over it, Like, so we in a Black family, we believe that sometimes time will heal wounds. So we don't necessarily need to talk always about everything. But if I continue to act in ways of love towards you, or act in ways of care and consideration, I know you might be sad, so I might cook your favorite meal. You know, we might try to do those little acts of service when we think people are going through something, but we also feel like it should be very time delimited. It shouldn't be this long. Now, wait a minute, now you need to get up now. That's enough of that. You know, you get a short duration to go through something, and then you do have to sort of get back for the system of the family. And so I do think that with that lens, though, that is a way for us to sort of intervene in the family system around how can we help them learn about acts of service that really are helpful for family members who may be experiencing stress or experiencing anxiety. How can we use our innate cultural sort of love languages to sort of cultivate wellness and uplift, you know, whether it's, okay, come on, you cook with me. So what's going on with you and little boy? I see you ain't coming around no more. You know, like to have them engage in these sort of wellness conversations in ways that feel congruent with how we sort of act as a family, I think is helpful too.
And I'm sorry.
Go. Oh no, go ahead. I was just saying, yes, Dr. Sharifa. I'm happy you cut in with that, because that is something that we hear commonly. A common thing, like, "Oh, you're still stuck on that," or "Okay, you can't get over that," or grandma's telling you, "Well, that happened in the past, and we're just not going to talk about that anymore." And I've seen that in Black American, West Indian, African, no matter what cultures. Like, we're just not going to talk about it. Like, let's just eat dinner. And I'm so happy that you brought that up, because that is really how things happen in our communities, and that's really the way that we've just been conditioned to process things. But why not integrate that with our conversation? So y'all, I knew y'all were gonna bring it. I was really proud of this panel. But yes, Dr. Sherry.
Well, I just was going to add, and that personal responsibility to have those conversations. I think that we've also, you know, we've got to be a personal commitment. I'll give you a personal example where when Dr. Sharifa said something, and I thought about sexual abuse. So that's what happens as well. And we know that African American women and men are the most traumatized. And so something that come up in some family friends. And I was thinking about, okay, so this is the pattern. This is the pattern of not talking about it. And so, you know, what can be a different way of handling it, so that it doesn't have to be that generational effect in response. But again, it does, and it takes courage. It took me being courageous and still being courageous to say what I think I need to say, and also, you know, being willing, but being willing to be sort of, and even alienated in being different. So I think it's a variety of things. But again, each of us, because everyone, there's different levels of insight and awareness. And so there, in some families, we are talking about it. And so as each family, small unit gets healthy, then how does that transcend towards the relatives outside of the family? How does it transcend into the neighborhood? How does it transcend downward? And if we keep pushing the conversation over time, you know, we have to touch and agree that things will be different.
And I see a lot of younger people who are the ones who are taking the mantle for their families. Like, you know, I have people in their early 20s telling me, well, my mom doesn't really believe in this mental health stuff, so, you know, she would never take me for treatment. Or, oh, I've had this and never been treated because my parents didn't really believe in all that, or, you know, whatever. So these young people are they're saying, forget it, I'm doing it myself, I'm going to take care of it myself. And I have seen some instances where the families are looking at the change in them and thinking, well, maybe there is something to this treatment stuff, or this therapy stuff, or this mental health stuff. And so once again, you know, sometimes we see that, and you're right. So sometimes it's going to make a difference downward, but it may even make a difference upward.
Muted.
We
I
can
was
hear
just
you.
gonna say, I definitely agree with that. What we're seeing with young folks, really changing our perspective and leading the way. I can think about my upbringing and my family experience, and words like maybe depression, anxiety. What's that? I'm from a Caribbean background, and those weren't common words that were used in my household. Sometimes it's seen as like a character flaw. This person is bad, or they're just not like a great family member, or all kind of terminology you can use to describe people. But I think that talks like this and just more awareness, and what we're seeing out in the open with celebrities and other people leading the way, are just really pushing that momentum where folks don't have to just internalize how they're feeling amongst their family members. But at the same time, on the flip side, I do want to make it known that our family members are important to us, and sometimes we are ashamed to share how we're feeling because of how our family will relate to us, and we're concerned about how they will view us. And so that's why we're here, or that's why a therapist is here, because that's an objective person that you can really speak how you feel and not worry so much about how they're judging you. And so we want to continue those family bonds. And so if you can't talk to your family or your friends, that's why we're here. Okay.
Yes, thank you, Dr. Topaz, because sometimes, you know what, the family ain't it. Okay. Like sometimes they just don't know what to say, and they're telling you something that is just not correct. I don't know if y'all have ever heard of this book called Queenie. I just finished this book, and it's about a Jamaican woman who is going through some issues with like panic attacks, PTSD, and trauma. And her grandmother finds out that she's going to go to a therapist, and she's like, "Oh, you're trying to bring shame on the family. Like, what are you doing? You're not going there." And the grandfather has to step in and say, "You need to be quiet. Maybe we can learn something about mental health from these younger generations and learn so that they're not like us, carrying all the things that we've been carrying on our shoulders, all the burdens, and how we haven't been able to let go of that." And on that issue of like generations of stress for generations, Dr. Nicole, I really wanted to talk to you because, well, I love you, Dr. Nicole, and also because you're the only Black person that I know from Oklahoma. and and I know, I think I told you that I've been like obsessed with like watching and reading all these things about the Tulsa massacres, and this being the 100th year anniversary. And I just wanted to know if you could speak on and shed a little light on, as we're here talking about generations and families, like the type of stress that things like the Tulsa massacre, these killings, because we know that it's not just in Tulsa, it's not just Greenwood, it's everywhere that things like this happened. And how has that impacted the way that we deal with anxiety and stress as a generation, as a Black community as a whole?
Yeah, I've been in Tulsa for over 20 years now. And moving here was a complete culture shock for me. I just learned about the race massacre right before I moved here. Somebody bought me a book when I graduated college because they wanted me to know about it. And I mean, like so many people never heard of it before I was moving to Tulsa. And then coming here and have an opportunity to see the community, and having been here 20 years, and now having the chance to get to know the city and getting to know different parts of the city. It's heartbreak. Like heartbreaking is like the first word that comes to mind when you think about not only did it happen, but it happened, and then the effects of it just are still there. Like it's just still laying all out there. You can still drive in that area of town and see steps where there once was a house and there's not a house, or you drive around an area of town and you see, the university run by the state, and you see all these things, and like this land was taken from these people. Like it was taken, it was stolen. And recently with digging in the cemetery and looking for unmarked graves and looking for bodies to recover so that people can have proper burials, like those things are heavy. I mean, there were people from the community who were there and would carry those bodies to where they needed to go. That's a lot. Like that is a lot. And for it to be a food desert area, and we're just celebrating, we're getting our first grocery store in like 10 years in this area. That's a lot. Like that. I mean, that's just a lot to wrap your hands around. And to continually be in something. I always say it's really hard. It's hard to experience any kind of traumatic experience, but it's especially hard when it doesn't end, like when it never ends and it's just constant trauma, and like what we're all dealing with right now with all these police shootings and stuff. There's no end. I mean, it's not like, this one thing happened and then we're done with it and we can move through it. We never move. We're still in it. Like we're still in it every day. And so I think that's how the community, I mean, that's how the city functions. I mean, and it really doesn't matter whether you are from here or not, I think we all feel it. We all feel it. And we know those things are passed down generation to generation. And, I still hear stories of people telling me, oh yeah, growing up, my grandparents told me not to go beyond this particular highway or not to go beyond. And we see that in all kind of, we see that cities across the country where you had your area. How limiting is that though, when there's nothing, the area you're supposed to be relegated to is an area that doesn't have the stuff that the other areas of town have. It's just limiting. And there is, I think you can't help but have a certain subset of the population develop some of that learned helplessness kind of stuff, because it, like, you just don't try. You stop trying, right? So there are people my age who may say, well, I can't apply for that job because it's, they're on that end of town. And I'm like, no, we're going to apply for it. They pay you. You can buy gas. You can drive over there. You can still do all that stuff. But it's hard because it just limits even your thoughts about what you can do. Mm-hmm. And you live in a cage.
Yeah, definitely. A whole community of stress. And this creating a insular, stressful, anxiety-driven community that you kind of feel like you can't get out of. Dr. Sherry, you have something to say? No?
Yeah, I mean, I guess I was just sort of thinking about just in terms of like wellness. I think one of the questions that you had was Black mental health professionals. And I think that I've been working on being more candid with people about what I do for wellness. And so what has wellness looked like for me? One was, I think I just stopped combing my hair. I was like, I don't have any capacity to comb my hair, much less makeup. And don't even ask me about any clothing. So let me take all that off the table because I just can't do it. Okay. And since I'm married, even with sex, okay, sweetheart, I know during COVID, you're not thinking about anything because I have no libido. Okay, none. And so that was just another thing. Another thing was I invested. And fortunately, praise God, I have money to invest. But even like this was someone I said today who is trying to come out of a job, your wellness is going to cost something. So that means that I know that you may have typically gone out to dinner and done certain things, but you really have so much body stress. And I know that we have all the medications and even psychotherapy and even exercise, but the tension that's in the body, I think Dr. Sharifa talked about it, it's got to be some different types of wellness interventions. So I think definitely for me during this time, I've been more open to, so what is Reiki? Okay, all right. And I actually sent somebody to Reiki. Okay, Reiki. I've never done it. I was like, you need something else because this medication, this Xanax, this CBD, this marijuana, it's not enough. Okay, you do reflexology, you do inhale the salt. We did a couple weeks ago, we did an ancestral sister healing. We did libations. And I said, one day I had the drums on YouTube. I was like, Lord, I'm going to need something else because the regular tools are not going to do this for me and for a lot of us. And I also invested in a spiritual counselor and meditation coach. And I pray, but I'm not a big meditator. And I was like, let me go sit, like we used to hear, go sit your ass down somewhere. Go sit down somewhere. Let me sit down with Dr. Carol and breathe. Okay, come on, breathe. Just try to just do something else.
And sometimes you gotta take stuff out. You gotta kick some stuff out to free.
Stuff.
You know, we gotta add some stuff, but sometimes we gotta cut some people off. We gotta cut
some committees,
some activities out. We gotta
Absolutely.
shorten that list of our obligation. Like I've been taking more stuff away than I probably have added over this last year and a half, and it feels good.
Ditto. And I had most, because I did most, I mean, I'm sure most of us have been very active on several different groups, different panels. And I had a big group in Houston, and I said, how are you all more busy now during the pandemic? That's just absolutely, that's pathologic. That the fact that during the pandemic, you're busier, you're on more committees. That's nuts. And I hate to use that word, but I said, this is nuts. So please do not commit to any more committees, no societies. Don't pledge if you can, unless you go do something else off.
Dr. Sherry, I'm glad that you mentioned like alternative type of treatments, because when I think back to my training experiences, I don't feel like I basically feel like I learned Eurocentric type of treatment modalities. And that's one way of looking at things, but I think it's important for us to be open to other ways of healing that doesn't just include medication therapy. That is definitely one modality that we can utilize, but that's primarily, what we're taught in our training. And so thinking back to before we had those type of medications, what did ancient communities, what did African systems, what did they do to heal? You mentioned Reiki. There's all types of different ways that we can incorporate healing in our lives, and it doesn't have to only be what we learned in training. And so that's what I think it's important for us as providers to be non-judgmental and open when we are talking to our patients and hearing from them about what kind of modalities vibe with them, and figure out a plan and collaborate together. So I could talk more about training, but I'll stop there. But I think that's important to encourage.
That's very important, Dr. Topaz. And I'm happy that Dr. Sherry brought that up because, of course, that I'm going to ask y'all about what can we do for ourselves as clinicians. Like, I'm very big, of course, I'm a patient advocate, and I know that Amber's as well. But I need to advocate for myself and you all. Like, what can we do to advocate for ourselves? So, Dr. Topaz and Dr. Nicole and I are a part of the BPA, the Black Psychiatrists of America. And during the pandemic, we had some people had the opportunity to go through healing circles. And I was like, oh, I missed the sign up. It went so fast. Like, geez, I missed the healing circle, and I'm over here doing more work than I've ever done during the pandemic. I need to be in the healing circle. Like, what can we do as healthcare providers, as clinicians, as mental health professionals, for ourselves? So I would just say that, first of all, I get massages. Okay, I don't care. And I'm not canceling it. I'm not moving it for this panel, for any work, for my resident on call. No. Okay, once that's on my schedule, that's where I'm going to be. And also my therapy. Now, the only way I'm moving my therapy is if I have to be in the emergency room and one of my patients is having a big crisis. But other than that, I'm going to therapy, I'm going to my massages, and I'm going on walks, and I'm listening to music, and I'm getting away from the hospital for at least like a 20-minute, 15-minute, whatever it is, walk just to take a lap. Because, y'all could be a lot in the hospital.
I'm definitely have to agree with you there, Dr. Harrison. I am taking a walk. Nobody's going to come in between me and my walk at the end of my workday. I also really enjoy lighting my incense and watering my plants and making sure my place looks the way I want it to look. So just having things organized, making my smoothies, drinking my tea, making sure I have my water, just those things alone really do implement that sense of wellness in my life. So I totally agree with you.
Well, I added an hour in my day, and if I want a nap, I take a nap. And if I want to sit down and eat lunch, I sit down and eat lunch. If I want to go lay across the beanbag chair in the room and bug everybody else in my house, that's what I do. And so just allowing myself to do that, because we act like lunch is like a sin. Like, just, we just assume we should be charting and trying to eat at the same time and not get stuff in your keyboard, and we should be in meetings at lunch, and we should be, but just like giving myself that hour during the day where I just don't have to be obligated to anything has been so helpful. And just realizing that I just got to do what I got to do, because you know what, I've never had a day in my career I could work 12 hours where I'm sitting at the end of the day going, man, I have nothing left to do today. It's always something else that's left for the next day or the next day. We always have something left, so we have to learn to like cut it off, set the limits, and that's just something I've done this year, and I haven't been any more behind than I have ever been.
This is true, Dr. Nicole. I know that I need to add that to my schedule. An hour of I don't have anything, and I don't know. I'll try, but thank you for that. Dr. Sharifa, I know you're about to come with some tips.
Well, I like to focus. I tell people to try to focus on the 5 senses. So try to engage around self-care in terms of what we are smelling, what we can listen to, what we can taste, even in terms of water, what we're touching. Do we have fabrics? Do we have clothes that we like, that feel good on us? And then I also try to encourage people to think about dosage. So we want to think about things that we can do hourly, things that we can do during the day, things that we can do every week, and then annually. So every hour I'm taking a 5-minute break to breathe, relax, walk around, things like that. But then I also had during the pandemic to really shift the way I think about my life. I felt like I was at odds with things that I had wanted, right? Like I don't know why I decided, but I decided to do a renovation during the pandemic. So I had to pack up my basement, but I was going through my senior yearbook and I had wrote in there that I wanted to have 6 kids. And I was like, what the world was I thinking about at 18? And I have 4 children. I have 4. I almost reached the goal. But I said, this is what you wanted for yourself. This is what you were mentally manifesting at 18. I didn't even know anything about that. And now that I have it, I act like it's the biggest stressor that I have. So I had to shift and say to myself, I clearly, a part of my innate being, wanted to be a mother, wanted to be a matriarch. So I have to look at these children and look at that role in a different way. And once I sort of had that shift, like I'm welcoming them as the manifestation of my own consciousness, then I began to be much more grateful and much more light in terms of mothering and being a mother, and not feeling like it conflicted with my professional self. And so I did have to take a step back and be like, wait a minute, this is the life that I dreamed of. This is exactly what I wanted. And so now I have to welcome it and feel flowy and flowing in that space. And that was a huge shift for me. In terms of my self-care and my wellness. I would say I'm probably the opposite of Dr. Sherry. I was buying more makeup this year than any year. I got a whole tub of different hair products. I didn't try everything on YouTube. So I was like, I'm just going to be in here getting to know myself all over again. I'm about to play in my hair, put on new makeup, buy new outfits. So that was definitely something that I was doing during the pandemic in terms of self-care as well.
Yes, Dr. Sharifa, I have seen your pictures on Instagram. You have been bringing the flyness. You have been looking extra fly in the pandemic. And I was like, I can't even roll over here. I'm about to wear my robe to work. But you are over here looking very fly. I used to be very into my outfits, but in the pandemic, I'm wearing scrubs. You're lucky if I change the color of my scrubs for this hospital. That's all I can give y'all, because you almost got a robe. So thank you for those tips. Those are very helpful. I just wanted
to jump in here. Sorry, Danielle. Yeah. I just wanted to add in, since we mentioned what we're doing for self-care. And I think with millennials, social media is like a big thing, and, you know, fear of missing out. And especially during the pandemic, you know, we didn't have anything else to do. So some people got more into it, less into it. I have really started doing social media breaks, social media cleansing. You know, I just don't need all that information overload. I don't need to see what everybody and their mama is doing all the time. And
Oh my God, yes.
you know, you don't consciously sometimes compare, but I mean, you do. Let's just be real. Let's just be human. And I just don't need that all the time. So sometimes I just have to be like, you know, I'm not gonna engage in social media that way, or I'm just going to engage with my smaller circle of friends, not like a 0 to 100, but just bring it down to 50, and
I know
focus that time that I would be scrolling or looking at other things on me. So that has been one of my helpful tips. Just
yeah, I want to
thank you.
I want to add to that.
I know that's Amber's forte over there.
Yes.
Yeah.
I mean,
yes.
Although I do like to see what y'all are doing, I do look at all of your Instagram.
Yes, I was gonna say
Amber is very into like taking social media breaks, and that's what her new company that she has founded is about. So Amber, I know you're gonna enlighten us about this as well.
Yes. Oh my God, Dr. Topaz, thank you so much for saying that, because it is so important to disconnect. Right now, with everything that's going on, it's important to just separate from everyone. And like you said, those comparisons are real. They spike that depression, they spike that anxiety and that stress. And it could be, you know, colleagues, peers, people you're connecting with, people you know. And I think that it still happens, you know, so it's very important to disconnect. The platform I'm creating is actually an app. So it's going to allow you to monitor that social media exposure and then set timers so that you know when you've been strolling for way too long. So I'm really excited about that. I'm glad that we're talking about how that's important for us to do. And I'm looking forward to putting that out there for us to use.
We cannot wait for that, Amber, because I know some people, not me, but some people might go a little bit too much in the evenings when they're supposed to be asleep. So let me say thank you all for those tips, especially for healthcare providers, for clinicians, for ourselves. And I just want to remind everyone that we do have, for DC, for healthcare workers, we do have, like, I don't know if people understand the privilege of free mental health services sponsored by Howard University's R&R project, and also from the Department of Behavioral Health, like free. If you live in DC and you need help, you need support. If you are a healthcare worker across the country, we are here to help you. There's a survey that we just put up, and we will put it up again so that you can continue to have things like this where you get all these expert panelists in one place for free, but also one-on-one therapy and referral services as well for DC residents. So if you can complete that survey for us, and you can keep us coming back here, and how it will allow me to do this as part of my job. So shout out also to Dr. Hall Brown for working on this project with me. So we do have more questions. I will ask some of the questions that we see coming up. I just really wanted to put out here a comment that we got, that self-care is just saying the word no. I often say that saying no to others is saying yes to yourself. And understanding that you can only do so much and focusing on one thing at a time is huge. I think that I said it's not the Black Women's panel, but I think as Black women, that we all know that we take on a lot of things a lot of the time. And just so thank you, Muna, for this comment, because I think that we can all feel this, that self-care is not, I mean, it is getting your wine, it is going to the spa, but it's really protecting yourself and preserving things for you. And that is what I am definitely founded upon. All right, so ladies, we do have a lot more questions here. I don't know if we're going to get to all of them because I want you to practice your self-care. But I do want to know, I want to ask Dr. Topaz and everyone on the panel, if you think that race and racism were well acknowledged and addressed in your training so that you could address anxiety and stress in the communities that you serve. Did they talk about it? Did we learn about this?
No, the answer is no. The answer is big no. Again, we have to think about the history of psychiatry, American psychiatry, and those who, came up with the curriculum or what we need to learn, and think about if we were included in that discussion and those conversations. And so, no, I enjoyed my training. It was, what gave me the skills I have today. But I was always frustrated because I felt like the elephant in the room when it came to psychosocial stressors was about race and racism and perceived racism for patients and how that impacts them. I've had experiences where patients have told me directly about experiences of racism and how that has perpetuated their depression or caused them to be anxious. And I would create space for us to have that discussion, because I would think to myself, where else, in what other setting, are people able to be open about this type of trauma? It's not many places that you can do that. And I think psychiatry as a specialty has a unique ability to really focus on this in a systematic way, the same way we focus on substance abuse, homelessness, and other psychosocial stressors. I would love, and what I started doing in training is documenting in the subjective what my patients share with me. And I would love to have seen a way that translated in our formulation of our assessment of patients. I think that does two important things. One, it validates the experiences that our patients are having. Again, they may never have shared these experiences with anyone else, a family member or partner, no one. And so it validates for them that it's real, it's happening. They're not imagining it, this gaslighting feeling. And two, I wish it was systematically documented in notes so that we can go back and study this and be more pragmatic about how we're going to change and address how the trauma of racism and how it affects our mental health. So no, it's not directly in our formal training. And that's why I think a lot of the other psychiatrists here, we have to, in our outside of training, reimagine what we learned and reapply it to our patients. For me, it's thinking about social anxiety. That's not something that I really thought about with Black people. But as I'm now in my attending life, I'm really now thinking about this diagnosis and how people perceive others, or thinking that they're going to say something wrong or embarrass themselves, and how that relates to race and race relations, especially. So the answer is no, and I wish psychiatry education would change that.
Yeah, let me chime in. I think it also depends on where you're located and the diversity of your academic department. I mean, fortunately, I came out of Baylor, and so when I think about, and we didn't have, I think I was one of 4 Black residents, maybe 5 residents out of a total of 55 at Baylor, but we did have people like Toy Harris, we did have Napoleon Higgins, we did have Kathy Flanagan, and we had an African American presence, and not just African American. There was and Houston is very diverse, so that was another benefit of being in a diverse city. There was more diversity across the faculty. So, but I do agree that overall that there's a lack of diversity in our training, in our faculty, and that does impact how we what we receive. But there are hubs, but we do need to do more.
I trained at Baylor too, and I love all those people.
But we had the Texas Mentor Minority Network. Yes.
And so, yes. Sorry to cut you off. I just got
so maybe it changed, but
it didn't. I love that those people are still there, and that's part of why I chose that program.
Yeah.
But I think that's on the micro level. I'm talking about macro level. Yes. In terms of all training programs. We need to address this systematically, and we did create pockets where we felt supported and found ways to manage this on our own. But that's still not addressing the large community. So I just wanted to put that in there. But yeah.
Yeah, definitely.
I'm in Oklahoma. We didn't have that. We didn't have.
I
was at Howard.
Dr. Cole.
And
we didn't. I wasn't in Howard. I wasn't in Texas. I was in Oklahoma. I didn't have any of that. I think we need more of us in general in leadership positions in academic settings. And I say that as a person who was in academics and had to bounce because they was trying to kill me. But we need more of us. I mean, trainees need to be able to see us. I mean, but it wasn't in my training. I mean, we had, you have your obligatory lecture on African American mental health, but that's not helpful. As a Black physician in a predominantly white space, I can't think of a time that a patient either called me out my name with a lot of times the wrong racial slur, because apparently I'm ethnically ambiguous to people here. But I can't think of a time that happened and anybody in my training program even said, hey, how are you doing with that? Or how are you feeling? Or how was that? Or are you okay? Is there something I can do? It never happened. So not only are we not, we're not teaching us how to deal with that with our patients, but we're not even teaching us how to handle it within ourselves, which is going to make it very hard for us to be able to handle it with our patients.
Yeah.
At Howard, we had a very different experience. I mean, we were black. I mean, beautiful. I mean, I'm so fortunate. Our program, our counseling psychology program, is one of only 2 APA, American Psychological Associated accredited PhD programs housed at a HBCU. We are the only one that has a majority African American faculty. We have an African psychology course that is mandatory that we have to take. So I was learning about Imhotep. I was learning about the Ma'afa. I was learning about Black people and indigenous ways of integrating African psychology into psychology. And we were so enculturated in Blackness that when we would leave to go on internship, we would have to talk and say, this is it. You're going out into the real world of psychology, and you are going to experience microaggressions and racism in a way that you've been sort of capsulated from in your training. And so we want to make sure that you're prepared to manage that with your peers and your colleagues. And so I do think it was very beneficial. Like all of my students' current dissertations look at racial identity development. I mean, like they look and ask questions and think about psychopathology in a very nuanced and critical way. So when we have accreditors come, they're always like, you guys get culture so well here. Like, how do you all do it? Like, they're always so impressed. And we're like, yeah, y'all should hire us as consultants so we can teach y'all how to implement.
Yes, that's what I was about to say, Dr. Schuster. That's how I get my extra coins over here. Of course, I'm also from Howard, but even prior to Howard, I went to Rutgers, and we had extremely like black, like Africana studies. Like it was like, a relief for me to leave my, biology and genetics classes and biochem, where I was maybe one of 3, to go over to my Africana studies classes. And they reinforced that for us. And then when I got to Howard, I was like, okay, this is where I'm supposed to be. And it is definitely different, because when I was in residency, my friends in the APA would say, like, you're in a bubble. You don't really know about the real world. I'm like, no, you don't know about the struggles of being at HBCU. We don't have this. We don't have that. Y'all got iPads on your first day at the hospital. And they're like, no, you don't understand what it's like to not see anyone who looks like you in a leadership position, in a teaching position. And the only people who you can identify with are your patients, but they're being ignored also. So it's really time for us to make these changes. And I see comments in the chat about changes in medical education. If you know, myself and Dr. Morgan Medlock, Ruth Shim, Sarah Vincent, Helena Hansen, all of us really trying to make these strides and efforts to change things in medical education, because as Topaz just said, like, it's not addressed. Dr. Nicole said it's not addressed. Dr. Simpson said it was addressed, but sometimes, it's wavering. It's dynamic. It can change depending on who was in the leadership position. And that's for all of medicine. That's for mental health, but where we really need to be aware of it, as we have talked about tonight, about how race and racism really affects us. So I know that I'm going to try to respect all of you ladies' time, but I have one more question for each of you. If you guys, ladies, non-binaries, could address, where do you recommend people from the Black community go to find more information and resources regarding their mental health? Anyone and everyone.
All right, so I'm going to show out for Black Psychiatrists of America. I am so honored to be a part of this organization on the e-board, and the BPA has been lifting minds since 1969. We didn't just, show up last year when Black people were cool to include and think about. We've been doing this work since that time, and I really want us to, everyone here that's watching, to think about becoming a member of our organization and support us. We want your creativity, your energy. We want to really continue to do the work that we've been doing. And so I want to just share the BPA's website so that people can become members and we can collectively continue to do this work together. So the website is blackpsychiatrist.org. We have different membership categories for psychiatrists, for other mental health professionals, for residents, and for students. Our membership is free. If you want mentorship, if this is a career choice that you're thinking about, we want to promote great mental health for Black people and Black people across the diaspora. So please, that's one great resource.
I second that resource. Thank you, Topaz.
I would also add, you can look at the Association of Black Psychologists. They have they're a national association, but they also have different chapters in different cities that do things as well. And then I would also like to mention social media. If we are using social media, we do want to make sure that we are following all of the panelists as well as other Black mental health professionals on social media, looking at Therapy for Black Girls, that podcast. If you're into podcasting, they have a lot of episodes related to Black women mental health as well.
Yeah, I wanted to add to you, Dr. Sharifa. I am an advocate for monitored media usage, but I do agree that a lot of the platforms that I have found in regards to, resources I've needed for my own members and my own clients have sometimes come from, social media, using that search engine and actually honing in on, this platform itself, Black Psychiatry, and finding people who look like me and are interested in what I'm interested in and can really voice and speak to and are educated about mental health. So definitely, if you're on those platforms, make sure that you're using them to the best of your knowledge.
Yeah, I would say even your personal connections. I think sometimes we're, we'll ask each other all day about who's your hairdresser, who did your hair, who do you go to for this, but I think if we just ask about our healthcare, like who is your doctor? Who is your OB-GYN? Who is your family medicine? Are any of my Facebook friends seeing a therapist? Do you recommend, I think getting personal references is also very, very appropriate and just not something we do a lot, but I think it's important in addition to the resources that you all named.
Yes.
And my go-to book, I don't know if y'all, this is an old book, but it's Saving Our Last Nerve. And I'm always surprised the number of Black psychiatrists who don't know this book, but it's by Marilyn Martin. I think it came out in early 2002, and it is still such a staple. So I'm a big reader. And so Saving Our Last Nerve. And then there's another one by Amy Barnett. And that's about all types of anxiety disorders in Black women. And I think someone else mentioned, Dr. Dana, you mentioned Queen. So I think encouraging our Black women and our Black community to do more reading, because we know that one of the issues with our care or lack of thereof at times is our lack of health literacy. So the more information that we have that is accurate, the better we all will be.
Yes, thank you. Thank you, definitely. And since we're pulling out the books, let me show you from my own bookshelf. I have to say that Black Pain is a book. This might be like early 2000s. This is a book that I actually got from Dr. William Lawson back when I was a resident or even a medical student at the Real HU. And it really helped to understand. I would really think that non-Black people need to read this more than Black people ourselves, but to understand that how Black pain manifests, and even if we don't look like we're hurting, we are, and the ways that we have learned to just try to cope with it and manage it. And then one of the reasons I don't like the term resiliency anymore is because a lot of times I feel like it's used as an excuse in a way to not address issues, but just say, oh, Black people are so resilient. Yes, like, no, we have a lot of issues and we need to address these. And let me just say that shout out to actual social media is how I got all of our panelists, because I follow all of them. And so that you should too. And of course, follow us on at Black Psychiatry on Twitter, on Instagram. The reason that I felt like it was important to really start this platform and really roll it out, it was something that even Topaz and I had discussed, like, oh, we'll make a Twitter page, and then we didn't do anything with it for like over 2 years.
Right.
But during the pandemic, I was like, no, I really have to work on rolling this out, highlighting Black mental health, highlighting the people who are out there. So social media can be used wisely to make these connections, to make these networks and build a community. So I really appreciate that Dr. Nicole also said, like, ask somebody who's their therapist. Like, I'm happy to tell anyone about my therapist because she is great. She is fly. She has natural hair and wonderful glasses just like me, and she works in academia, and it's because another Black woman told me to reach out to her. So it's very important about the networking. I would just like to say thank you to each of you, all our panelists, for being here with us tonight. Also, again, thank you to our partner and sponsor, of course, Howard University, and the Department of Behavioral Health. So again, if you need any help, if you need anything, please make sure you fill out the survey. We get back to you very quickly. And if you have any ideas about other things you want to talk about, other topics, just let us know in the survey. And I see that Dr. Prim, shout out to one of our mentors for all of the Black community here in mental health, said that Black pain was way ahead of its time as well for trauma and Black folks and how we deal with it. So ladies, again, thank you so much for being here. If people missed it, we will have the replay up for you on YouTube, and it'll be on Facebook as well. Just make sure that you follow each of us. Let me make sure that you can see there. Yeah, there we go. So we can see everybody's everybody's name on Instagram and the socials. Of course, me, I am a doc named Danny on Instagram, on Twitter. It's still me. I just have better pictures, it's pandemic time. All right. So thank you for joining us for talking about anxiety and stress in Black communities. And really, before I close out, I just want to make sure that everyone is aware that there has been a push to change the name of Bebe Moore Campbell's month. She had done so much before she passed away. Her family continues to do a lot for mental health advocacy and for recognizing that we need our own area, our own arena for Black mental health, Black psychiatry, Black psychology. It wouldn't be possible without her and the attention that she's brought, even as far as NAMI and the waves that she made there. Taking away her name and changing it to BIPOC Mental Health Awareness Month really just erases so much history and removes so much context. So if you see anything about this, we are going to bring you more about this, how to advocate, how to talk to your congressmen and women and representatives about making sure that they do not go forward with this legislation. So happy Bebe Moore Campbell's National Minority Mental Health Awareness Month, and only her month for July 2021. We can even call it her BIPOC I'm here for being inclusive, but do not remove her name. Do not erase her. And my panelists, I hope you go back and look at the comments. There were so many comments and cheering you on through the session, so you got to go back and look at them afterwards. Thank you to everyone who has supported at Black Psychiatry. Without our followers, without our viewers, there would be no panel tonight, because you literally, y'all brought it, because I was like, who am I going to get? And y'all just brought them all to me, so thank you so much. All right, everyone. Good night. Thank you for joining. Please do the survey. And are we going to be back? Are y'all coming back to Black Psychiatry? You're going to be back here? Okay. Yep. All right. Good night, everyone. Thank you.